What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, testing negative for the viruses, and having a great day so far. It is time now for the Thursday edition of the Virus Update for Thursday, July 17th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed with what's going on with these viruses. That's what I do here on my channel each and every day. Want to stay informed? Subscribe down below. Give this video a thumbs up if you like it. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. We do have a few news stories today. We also have an update from the UK. And we have a few other things that we're going to take a look at. I don't think this video is going to go over 15 minutes, but we'll see as we go along. I also do, at the end of this video, have some channel announcements of how things are going to go while I'm on vacation for the next week and a half. All right, starting off with this from Jammer. I'm not going to read the whole thing. It's just a reminder for you. COVID, there is the link to Alzheimer's, and the American Brain Foundation finds that the damaged brain fog caused by SARS-2 may be permanent and linked to Alzheimer's. Yes, we've mentioned this many times before in the virus update, but yes, COVID can be linked to Alzheimer's, which is not a good thing whatsoever. And of course, we know those who are at the early stages of it, it could quickly advance from a COVID infection to farther down the road. Yeah, it's not a good disease. You do not want to deal with that disease whatsoever. All right, let's go international for a moment. We're going to go international a few times. Dennis the COVID info guy. New South Wales respiratory surveillance reports week ending July 12th, 2025. The COVID positivity rate is 6.4%. That's down by 0.9%. Number of laboratories reporting COVID, 2 out of 4. COVID cases, 2,627. That's down by 21.1%. Influenza, 8,563 cases. That's up by 0.6%. RSV, 2,206 cases. Hey, that's down by 10%. And it looks like the NB.1.8.1 variant is now at 84% of the cases. KP.3, 5%. LP.8.1 is at 4%. XEC is at 3%. JN.1 is at 1%. And any other variants would make up 3% of the cases. It looks like all regions but Hunter are down for wastewater. Hunter is up for wastewater for COVID at this time. All right, moving back to the United States. Some measles news. Person with measles may have exposed people at 9 places in New Jersey. Yes, there are 9 potential exposure points in New Jersey. Not going to read them all. Today I am going to have a short post on my site with the latest, with the news stories used today, just because we're dealing with measles locations, and, well, there's several of them here that need to be listed off. South Dakota is reporting that they have 6 new measles cases. That's a big increase for a small state like South Dakota. 6 new measles cases are being reported in South Dakota. Not a good thing at all. Their total is now at 12 cases. And in Kentucky, Louisville is dealing with measles. Contact tracing shows potential crozier exposure. Yes, there could be an exposure at a crozier in Kentucky. Yeah, this is not good whatsoever. Looks like the exposure was on July 9th between 9:15 a.m. and 12 p.m. So, yeah, be mindful if you were in these areas. All right, moving on to this. COVID-19 returns to Bay Area at highest levels since winter. And you may have clicked onto today's video because this is likely to be the title that I choose, something like this. COVID-19 is at the highest levels since winter time in many places. It's not just San Francisco. There's other places. In fact, Florida, I think, is even passing the winter wave at this point. Yeah, Florida just continues to go up. So this is not a good thing whatsoever. And San Francisco is going up. Data published this month by California Department of Public Health shows levels of COVID-19 not seen since winter. The department measured the amount of virus in wastewater at different sites across California, while the state as a whole is measuring at moderate levels. The Bay Area, particularly San Francisco, is seeing high levels of virus pop up in testing. So that is not a good thing whatsoever. All right, also something else that's not good today. The UK saw a little bit of a rise. 991 weekly COVID cases. This was to be expected. Last year they had multiple waves In the UK this year, it looks like they may be doing the same thing. Maybe just a mini rise once again. Who knows what's going to become of it? I mean, so much testing there is done by at-home testing, so it's not really shown in the system. Who remembers when they had that public volunteer reporting system? Was it called ZOE? I think that's what it was called. Does that even exist anymore? I don't think it does. I think that stopped a couple years ago. Deaths 47. That's actually down by 12. Looks like healthcare. It says down by 237, but that looks to be the same number as last time. Then when we come down to the positivity rate, positivity rate is 6.03% in the UK at this time. Taking a look at my website, is there anything new that I want to show you today? Looks like, yeah. Now, nothing really that I need to show you today. Reminder, I will be working on the website next week while I'm away on vacation. Taking a look at Canada, wastewater viral activity levels. COVID is low, flu A is low, flu B is low, and RSV is low at this time. We'll take a look at the United States measles update in tomorrow's video. More details on tomorrow's video in just a little bit. It's going to look a little bit different. It'll look similar, but it's going to be done early and released later in the day. Tomorrow for me is a travel day. All right, India, 478 active COVID cases, and it does look like they do have one new death reported in India today. And let's see here. It looks like, yeah, just one new death has been added today. Moving on to the air qualities, which have been a problem in oh so many places in the United States. And we will see here that those problems still continue, though they are a little bit better today. First off, the West Coast is confined mainly to Northern California and Southern Oregon. Then you do see some problems in Colorado, Utah, Arizona, and New Mexico. Also some problems in Canada. That continues, and that is bleeding its way into the northern plains. Yeah, it's making its way there. And some minor air quality problems along portions of the East Coast as well. Taking a look at what's going on with the breathing index, and we do see it is poor across portions of the Four Corners region. Also, Oregon's not doing great, nor is Idaho, Nevada, Texas, Louisiana, and some moderate breathing problems across portions of Pennsylvania today. And I can happily report my breathing, at least up to this point, is not really being impacted today. So that is a good thing. Taking a look at what's going on in Florida, and we do see in Pinellas County, Florida, EMS calls there. There's a lot of them right now. Unknown problem. A lot of ambulances being held up at the hospital. Yeah, that's not good. Philadelphia yesterday, 841 new EMS incidents have been reported for Wednesday. Taking a live look at Montgomery County, Pennsylvania, and we do see respiratory emergency showing up several times. Cardiac arrest is showing up multiple times as well. That, my friends, is not a good thing. Taking a look at what is going on in Chester County, Pennsylvania, not doing too bad right now. Taking a look at what is going on with Bucks County, and I do need to refresh this. This may have changed since I refreshed a little bit ago. Oh, it did. There are now 10 calls in Bucks County, Pennsylvania at this point in time. Taking a look at what's going on with the hospital situation in Pennsylvania, and we do see the Lehigh Valley still is busy. Yeah, portions of the Poconos are dealing with busy hospitals, so there are some things going on there. In New Jersey today, we do see a couple hospitals. Inspire Center Mannington has a specialty issue, and we also do see a psychiatric issue at St. Peter's University Hospital. And Virtua Our Lady of Lourdes is on, looks like, a potential divert at this time, so that's not good. All right, New Jersey update for this week. Of course, it's got to refresh on this. So while it's doing that, let's pause and take that hydration break, shall we? Alrighty, New Jersey's update for this week. Emergency department visits remain low for COVID-19, influenza, and RSV. Though low, there have been slight increases in recent hospital admissions for COVID-19. Recent COVID-19 and RSV hospitalizations, and I do need to scroll this to the right, have, let's see, where did it go? Mostly been reported. I think they're talking about the 65 and older population. Test positivity remains elevated for some of the other viruses. Levels of COVID-19, influenza type A, influenza type B, and RSV are low. The predominant variants in circulation in New Jersey are XFG, NB.1.8.1, subvariants of Omicron covered by the 2024-2025 vaccine. And it looks like the dominant strain of flu that's going around would be influenza B at this time. Respiratory outbreaks recently reported in long-term care facilities are primarily due to COVID-19. Taking a look at what's going on in New York State today, the test positivity rate, or excuse me, we don't do test positivity rates in New York State anymore. So, New York State COVID cases on today include New York City's data. See, I got jumbled up there. How about that? 470 new cases have been added for New York State today, which, believe it or not, take a look at this. That's actually slightly less than last Thursday. Interesting to see that. I think that's last Thursday. Anywho, the hospitalizations in New York State, 239, and in the ICU, 23 at this time. So it did not increase for that today. Just cases because, obviously, we had the add-in from New York City. In Ohio, RSV is up slightly from the previous week. 5 people hospitalized. What was last week's number? Does it say? 4. Flu this week, 11 versus 18 last week. And COVID, we have 52 people in the hospital for COVID there versus 65 last week. So, hey, that went down. That is a good thing for Ohio. Alrighty, let's take a look at a couple of wastewater sites, and we will take a look at 2 of them for COVID, then some channel announcements, and then that will be it for today's video. Kind of a shorter video today. Let's take a look at what is going on. How about we come down here to Seaford, Delaware? Haven't clicked on that in a while, and we do see COVID at this wastewater site. It's still low, but it is rising ever so slightly. And we do also see here hepatitis A, just 1 detection back on May 14th. Everything else looks to be fine at this time. And then now let's go somewhere out on the West Coast, shall we? Where do we want to go on? We just talked about San Francisco, but I think, yeah, you know what? Let's take a look at San Francisco, shall we? Because San Francisco has been getting concerning, and we can see here it is, you know, some up-down movements, and they do put no trend as because of that, but it is listed high, and we can see it is elevated from where the levels were back in May for COVID there. So COVID is going upward, and we also do see HMPV is listed high at this time, and everything else is fine. Alrighty, folks, that does it for today's virus update. But before we go, I got to give you some announcements. There will be a virus update tomorrow, even though it's a travel day. I am going to record tomorrow's update early before we leave. There's a couple things I held out from today, and whatever news I find overnight. So I think it's going to probably still be a 10 to 15 minute video tomorrow. I'm going to pre-schedule a release, we'll say for, how about 2 o'clock tomorrow afternoon? And, of course, I will share it on social media when it goes out. I'm not the one doing the driving tomorrow. My dad's doing the driving tomorrow. So, that will be fine. I'll pre-schedule the release. It should come out at 2 o'clock. I am going to try and eventually catch up on these comments. I know I haven't responded to comments from the last several days. I've approved them, but not responded to them. So, I am going to try and catch up on some of them later on this evening. And, of course, come Saturday, or Saturday evening, I should say, I will catch up on all of this. Right now, I'm just, unfortunately, I am behind. The virus update will be continuing next week while I'm away. I don't know what time of day it's going to be. Stay tuned for that. I think it's going to probably be our usual time. Well, maybe a little earlier. Maybe it'll be between like 12 and 3 in the afternoon. I don't know. We'll just have to wait and see what happens. If there's going to be any missed days, I'm hoping that does not happen. But if there's going to be any missed days, I will alert you of that through X, Blue Sky, and of course the Facebook page. Alrighty, folks, that does it for today's virus update. I will see you for another update again tomorrow. If you enjoyed today's update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. Ways to support the channel are down below. Hey, we gained a new Patreon subscriber. Thank you to the person who subscribed to that. Eventually, I do want to do maybe like once or twice a week, do an extra something there for the Patreon subscriber. It won't be a long video, but something extra, like maybe a deeper dive into a specific area that just is really concerning for wastewater. Something. I don't know what it's going to be, but or maybe it'll just be about personally, how am I doing with long COVID? I don't know. But alright, I'll see you all again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.